There we go. Okay, so we are recording. So our local skills academy guest tonight is Dr. K, who is Thorndale's chiropractor. So specifically from Thorndale Chiropractic. And we're so excited to have Dr. K here to share her expertise. And I know as a patient of Dr. K's, I know that her modalities are so different than what I think people traditionally think of chiropractors. So going and getting a big adjustment and then, you know, coming back next week for the same adjustment. So I'm excited for Dr. K to share, you know, what makes her different and amazing. So that's exciting for anyone who hasn't had the privilege to be a patient yet of Dr. K's. And then I heard that Dr. K has a bit of an agenda to go through and some stretches at home and all that kind of stuff. So thanks, Dr. K. I know that you said you're nervous, and we tried to reassure you that there's really no reason to be nervous because, you know, we're all neighbors. Nobody's going to be too critical. Nobody's called me out on anything yet. And well, Mel was there last week when I told the realtors they had to be nice to each other. That everybody was. So yeah, last week was great, by the way. I was thinking about it and oh yeah, so Chelsea's still here. And what stood out for Chelsea from last week was
passed out naked people.
Yeah, Matt Santagapida's experience with the passed out naked people. So that's great to remember. So anyway, so Dr. K, do you want to take a minute to introduce yourself? Yeah, how long you've been in business here, where people can find you, and all of that great stuff?
Sure. Hi, everyone. Thank you so much for tuning in, I guess. It's, yeah, I'm not very familiar with Zoom, so thank you for calming my nerves. I hope it goes well, but I think we'll have a lot of fun tonight anyways. So yeah, I've been in practice in Thorndale for about 4 years now, and I feel like the 4 years have just flown by. You know, we've made so many connections, so many friendships, and I just think it's such a great community we live in. You know, everyone does look out for each other, and it's so nice to be part of this community. So yeah, Becky talked a little bit about how different I practice. You know, people have this perception that chiropractors, when you see them, it's usually, I should say, usually a sort of adjustment-based practice, and you know, you go in, they adjust you for the next 5 minutes, and you're out the door. And it is, you know, true. A lot of practices do run like that. I personally like to kind of treat the whole area. So I like to work on the muscles, you know, get the muscles to relax. And a lot of times it's also the muscles that are giving the pain as well. And so I like to kind of treat the whole area and any areas that could be associated with the pain as well. So I brought some of my professional tools. Thank you, Becky. Not my toys. Here at my place. So I'll go through sort of the things that I like to use in my practice. So laser therapy, it's light therapy, so it's very safe and effective. I've used it on infants, you know, on seniors. So it's one thing that I would use on most people. It really helps with healing. It's a healing modality, helps with pain, brings blood flow, and brings sort of the body's natural healing chemicals to the area. So that's one that I use on pretty much everyone. And then the other one that's a bit more invasive and a bit more loud, so prepare for the sound. This is shockwave. And what shockwave does is it helps to break down sort of tension in the muscles. I myself actually, you know, because I use my hands so much, I use it on my hands. Sorry, that's I use it on my hands to work on my hands, but it helps to break down tension in the muscles, scar tissue in the muscles, and helps to mobilize joints depending on where I use it as well. So that's a bit more invasive, but it is helpful. I cannot use it on, you know, children or young people who are not skeletally mature, but you know, other than that, adults, I can use it on us. And then those two are things. And then this one, thumper, is a hit with most people. It's a very comfortable massager. So usually after I do my modalities, I do my soft tissue massage, I'll use the thumper massager, you know, in the general area. So to help, again, relax the muscles. And I say to people, it's like a reward for taking my pain torture. And so that helps to relax the muscles. And usually then after that, I will adjust and, you know, the spine if needed. You know, some people are not comfortable with adjustments. then I don't, do that. So what I work within people's comfort levels. So if you're comfortable with adjustments, great. If you're not, then, we can, there are ways to work around it. And this tool is called the Activator. It's more so for people who aren't comfortable with manual adjustments. So it's like a clicker. So basically, it's what it does is the theory behind our adjustments, manual adjustments, that quick movement is what resets the joint receptors. So when you reset the joint receptors, everything relaxes. So this thing targets into the joint, for example, and when you click it, so it sort of does a quick thrust into the joint, and same thing, it resets the joint receptors. So for people who are uncomfortable with manual adjustments, this is a good alternative. And then other things I use, taping. So taping mainly to help with sort of pain, management for after the treatment. Sometimes people come in with really acute pain or inflammation, for example. Taping will be really helpful. It's a very elastic kind of tape. So it almost acts like a layer of muscle on you when I put it on the skin. And the tape will sort of take the load of the muscle so that the injured muscle can just relax and heal. So I think I covered everything for tools. And then, yeah, we can go on to any questions though, before we move on to.
I don't see any questions right now. Has anybody had one of those modalities and have a favorite? I think
Yeah.
everybody loves the thumper. I know you've given away the thumper in a couple of draws that we've had.
Mm-hmm.
Okay.
Thumper is the favorite. Yeah, all-time favorite from people.
Mhm. Okay, so I don't see any questions, so
Okay.
move on.
Sarah Adams said something about tape for baseball. Thorndale.
Oh, that's right. I'm excited for baseball.
Do you treat everybody on the bench? Like, should I be a member of your team so that?
We've been trying to get you, right? You know that.
Yeah.
That should be an incentive then, Becky.
Right. Okay.
Okay, so we're good.
Yep.
Okay, so I thought maybe today we'll go through some of the common pains in the upper back and neck, and I just want to maybe touch on this Uppercast Syndrome. That's what it's called. I don't know how to share screen, and I don't want to put a cat filter on, so I thought I'll print out and I'll show here first. So that's Uppercast Syndrome, and that's becoming more and more I guess common in our society these days, because we use the phone, we're on our phones a lot, we're on the computer a lot. So when we're on the computer, our neck, does tend to go forward a little bit, and we do kind of do a bit of a hunch. But there are ways, to help prevent this posture. And, we can obviously work on the, touch on that as well. But yeah, then because, we're on the computer so much, typical complaints from people, headache, and again, from the strained muscles and weakened deep neck flexors, and also shoulder pain from mousing, like mouse work. So those are kind of typical, pain. So that's the first one. Then I want to go through the muscle. It's called the suboccipital muscles. I need an overhead projector all the time, right? That's what I'm comfortable with.
I'm going to teach you how to screen your share. There's screen your share. And you can teach me how to talk. I'm going to teach you how to share your screen one time. It's easy. It's no big deal. Anyway, carry on. You're doing great.
So this is the skull, and these are the small muscles at the base of the skull. So a lot of the time when we get headaches, it could be the back of the eye, or it could kind of radiate this way. It's typically from the suboccipital muscles. And what happens is when we work on the computer, our head does kind of go forward, and that forward posture puts a strain on the suboccipital muscles. And then when they're strained, you can get trigger points in the muscles, and then they can radiate in this pattern. So kind of like a bend or into the back of the eye. Back of the eye, yeah. So how to palpate? I know it's kind of hard to teach palpation over the screen. But basically, if you can feel your skull, there's a bump sort of at the, back of your skull. And then if you just kind of fall off that bump into the top of your neck, yeah, that's usually where the suboccipitals are. And if you go on one side, sometimes if you press it, it can be quite tender and it can radiate into the back of the eye, or if it's strained, or the top of the head. Anybody has any question? I know it's hard to do palpation over the screen, but it's, yeah, on both sides. And is it tender on people? Any? Not too bad? Okay. So usually when I have, a headache or I feel a tension coming on there, I will put my finger there. And this is what I do on patients as well. I'll put my finger there, or thumb when people are working on it. And I'll turn, if you're on the right side of the neck, I'll turn to the left. You just apply the pressure. And then if it's tender, you'll feel it there, or it'll radiate to your head. But when you turn it, you kind of stretch the muscle, right? And you hold that pressure, and you can wait till it subsides. And that usually will help with headaches. Any question? Cheryl? Okay. So that's the first muscle. And sometimes I'll use
I saw everyone trying to, find their landmarks and
Yeah.
and everything. So we're
Uh-huh.
going to be standing in line at Sassy's, and we're all going to be just pressing on that area there and get rid of our tension. So perfect.
Or sometimes if you have a tennis ball, I use the AccuBall on myself. Harder on the neck, but I'll show you later what we can do for the upper back. But what I do too, sometimes I'll just kind of rest into it on the floor and just, let the tension ease and then move into the next spot. So yeah, some things that you can do at home. Okay, so then the next muscle group is the upper traps. So the upper traps, well, the trapezius muscle is a very big muscle. That's sort of where from the neck to the shoulders and into the mid-low back, well, mid-back more so. But typically when we carry stress, and we have a lot of stress, I think just in general, everybody does these days. We carry a lot of stress in the shoulders, and these are our upper trap muscles. And when it's tight, you can also get pain radiating up into the neck. And sometimes people will say it radiates up into the head as well. So, like headaches can be caused from neck and shoulder muscles. So for this one, and I'll show a stretch after too, but obviously it will be like the muscles along here. And for me, we're gonna get tight muscles. Same thing, I'll kind of, if it's the right side, I'll stretch my neck to the left. And I'll apply pressure. And most times, we do have tight shoulder muscles and knots can be there. Tender, anybody? You see here? And sometimes I'll use oil and I'll just kind of do a stroking sort of a motion, applying the pressure. It's usually, when I do it on people, it can be quite tender. And I joke, I call it my back alley attack. Because if someone attacks me, I'll put them to their knees. Yeah, so that's a good one to work on. The stretch is very simple, actually. The stretch is when you're seated, you can hold on to your hand to the chair, and then you just stretch to the side. And same thing with stretches, you can hold 10 to 15 seconds, do 10 to 15 times, or some people prefer to hold it for longer, 30 seconds, and you can do fewer times. So all preference. So that's the upper traps. We did that. Okay, and then and then the next one is called the rhomboids. Hi, buddy. Okay. So the rhomboid muscles are actually our shoulder blade muscles. So they go from the spine to our shoulder blade. So a lot of times people, especially office workers, would say shoulder blade pain is pain because again, we have that rounded posture at the desk. These muscles actually get weakened. Yeah.
Is it okay if I have the Lego? Because I want to Lego. There's a Lego guy.
Okay, yeah, for sure. Sorry, I do have a babysitter. Sorry. So yeah, because of the rounded posture, we get weakened upper shoulder, upper back muscles. So it's good to strengthen that. And then for this muscle, it's actually a difficult muscle to stretch. The kind of, or to get to, because on yourself, it's kind of hard. But the muscle, the stretch is this way, and then you can look down for it. But when I have pain there, I like to use my tennis ball or my Accu ball. So basically, I go on the floor or on the wall. You put it there, and you don't necessarily have to roll on the ball. You can just sort of put in one spot, ease into it until the tension eases up, and then move on to the next spot. And then it's important, obviously, to breathe through the points. So that's the rhomboid muscle. And the last one I want to go through is the infraspinatus. So the infraspinatus is actually a rotator cuff muscle, and it's very much affected with mouse work. Even though, like computer work, like it's not a strenuous job, but it is repetitive. I think that's why people, have so much pain from computer work, especially mouse work. It's very repetitive, small movements, but you can sort of strain that muscle in your shoulder as well. So it's here, this muscle here, and it tends to radiate down the arm. And sometimes people will complain to the elbow or wrist, but it can be coming from the shoulder, back of the shoulder, I should say. Okay, so to stretch that muscle, it's called the sleeper stretch. So basically, you go on the floor and you lay, it's kind of hard to show, but yeah, you want to lay on your side, and then you just kind of bring that arm down. But what I also like to do is with the Accu ball, I'll put it right at the edge there, and it can be quite painful. So yeah, just breathe through it, and I go from point to point. And then yeah, I think I covered all my muscles, Becky.
I was just thinking, like, I feel like I missed an opportunity for a treatment. I could have been your test person. Demonstrated all of this, right? Like, one of us would have offered.
For sure.
So I think that was great, like kind of talking about those 4 different muscle groups that are affected by our poor posture sitting here, at the computer. So kind of correcting our posture, but then also trying to find ways to limber it up ourselves. I was just wondering, like, should anyone, do we ever have to be mindful of certain landmarks or certain things that we're putting pressure on, or anything like that? Are there little tips that people should know just to avoid maybe doing any kind of damage or adding more strain, or just come see you?
Yeah, for sure. So I tell people, especially now, I think, people are working from homes, different workstations compared to, your office space. Yeah, so obviously more people are affected, I think, with pains in that sense. But what I tell people in general, it's a good thing to take a short break, even if it's like a minute or two, every 20 minutes. Because when you go past the 20-minute mark, the muscles do tend to tighten up and, in that sense, contract. So every 20 minutes, if you can set the alarm on your computer, just even stand up or do some, stretches. So there's a stretch, it's called the Bruges Stretch. It's essentially doing the opposite of this. So what we want to do, we want to tuck our chin in and then open our chest. So you can hold it for 30 seconds. So even just doing the 30 seconds every 20 minutes will really help with, the pain.
Awesome. Thank you.
And then if it doesn't go away, then let me do the back alley attack on you. I'm just kidding. No one's gonna go see.
I'm wondering, now you were showing the use of the Accu ball or any sort of balls. Is it preferable to use those while laying on the ground or use them pressed against the wall? Which one's a better use?
I use them on the ground. I do prefer them on it because I find that the walls on the ground, you have your body weight into it, and you can sort of adjust if it's too much. But yeah, I personally use them on the floor. Yeah, the bed would be too soft probably. So yeah, floor, even if it's carpeted floor, would be And then if you can't do on the floor, the wall would be the next option too. Harder to control though on the wall, I find, whereas on the floor it's easier to get the ball into the spots.
Good question. Has everyone experienced Dr. K's grip strength? Some nods, some shaking of the head. So honest to goodness, like, I don't know how she gets that much force into these like 10 digits, but it's like the most incredible, it gives you goosebumps, right? Anyway, so you definitely want to experience that. Okay, so we've reviewed different muscles, a few stretch suggestions. Okay, does anyone have any other questions so far?
Are you running through lower muscle groups like hips and lower back at all?
Not today, but do you have any questions about it? I can definitely.
Because generally sitting is really bad for you, right?
Right,
And
yeah.
everyone's sitting now. So I didn't know if you had any strategies to help with tight hips.
And hip flexors too, right?
Yeah.
I do use glute stretches. I'll just see if I can move my desk setup here. But I do use this as well into the glutes. So the stretches are good as well. And then hip, I'll try to see. So it's a figure 4 position. So basically, I'm sure a lot of you have seen this, but basically you do the figure 4 where you put the one ankle on the knee and then hands on the other knee, and you just kind of lean forward, and that should target the glutes there. Is that kind of okay, clear, or kind of hard to see? It's hard to see, right?
No, it's good.
Okay. And then there's the QL stretch to help with like our back muscles here. So I'll pretend this wall is the floor. And then usually, it's hard to see again. I'll, lay on the floor, one knee across, and then this, So that's for that as well. And then the hip flexors would be the one where it's the lunge, where you kind of lunge forward, you stretch that hip flexor. And the hip flexor is actually quite a difficult muscle to get to. So when you do that lunge, I personally would kind of just go in and dig a little bit, just put some pressure on that muscle. Just to get a little bit more. But you're right though, Lindsay, like most people are sitting now and there's a lot of glute and hip pain.
Mm-hmm.
But I would use, if you have a ball, a tennis ball, even into the hip here, kind of dig into here with the laying into it on the floor as well. And IT band, like the foam roller is good for the IT band. I have this on, I don't use it a lot, but this one you can use it kind of on the quads or some on your glutes as well. Give me 1 second. Yes. Oh yeah, you have to ask mommy, okay?
I think everybody who has a foam roller like doesn't use it, right? Aren't those like you just buy that and then you never use it? Or is that just me? It's like the exercise bike that's for hanging clothes on and
Right.
Yeah.
Right.
Yeah.
He uses our foam roller. He swears by it.
Yeah. Good job.
Yeah.
Like,
He has a big one too.
It's painful though, eh? Like,
Yeah. Oh yeah.
yeah, to really like lay into it, especially the hips, like this, the side hip. So, all right, now it's time for my filler, I guess. So if anyone hasn't been to Dr. K's office, it's at 160 King, which is the old fire hall. So where Thorndale Repair Shop is now. So it's on the second floor. So when you enter the building, if you go up the stairs, and then she's the first hallway on the right and the first door on the right. So that's where you can physically find her, and definitely all of her contact information, email and Facebook page and all of those, how to reach her to book an appointment is definitely on our business directory. So that's where you find her and how to find her. And someone needs it right now.
It's ringing through the laptop. Yeah. Thank you. Yeah, thanks, Betty. Sorry about that. Okay. And before I forget, or I don't want to forget, I should say, I want to kind of show people, because you can use tape at home as well for your pains. So I'll kind of show quickly what to do if you have tape. And I buy my tape actually just at Shoppers. And this brand, the TheraBand brand, is actually quite good. in terms of like how long it'll stay on for. Even if you go for, you know, the hot tub or shower or swimming, for example, it will stay on pretty good. So it's a pretty simple technique, and you can use it on yourself. Hard to do some places. But if you have someone to do it for you, yeah, you can cover quite a lot of areas in the body. And it's a very simple technique. And I like to, sorry, give me 1 second. And I like to use it over the pain areas. So for example, if you have pain in the shoulder blade, I'll start from the lower part of the shoulder blade and pull it up here. And then if you have pain in the shoulder area here, I'll start here and I'll pull it up here. And when I say pull, you'll see what I mean, because it's a very elastic tape. So usually, you know, it's typically they're pre-cut, but you can buy them where you cut yourself. But it's just more convenient pre-cut. I guess in a way you just have to be more mindful of the length. So if, you know, for example, someone with elbow pain, you know, if you have elbow pain from typing or playing tennis or, you know, golf, things, something like that, we tear at the end. Sorry, I should mention this. We tear at the end, and this becomes the anchor piece. So you start from one, and usually positioning of the body, you just want to get a neutral position. So you start with one end. Okay, so then that's your anchor, and you rub it down to make it stick pretty good. And then, so it's the same technique, you know, wherever you use on the body. And then you kind of pull it, not all the way to the end, maybe like a little bit left. And then you stretch it. So 100% would be like you stretch it all the way, but usually I go a 50% stretch, and then you go over the pain area, and then you rub it down, and you rub it again just to get the to stick well. And then the end piece is again another anchor point, so you just put it on there, and that will really help if there's inflammation, for example. This tape is really good for inflammation, because the theory behind it is it helps to lift the skin up, so there's lymphatic drainage. It's going to help with draining the. So I use shoulders. Again, hard to do on your own with some areas. For example, you can do your knee easily, but you know, I tried to do my back one time and I totally missed the area. So if you can get someone to help you too, that would be good. And also, so tools that you can use at home, like a AccuBall. There's also something called gua sha tool. I believe you probably can get something like that online. I get mine when I go back to Singapore to see my family. So basically what it does is you use it with oil is better. Yeah. Oil or any, you know, that helps with, you know, sort of lubricant. But it's a traditional Chinese medicine techniques, much like the cupping technique with massage therapists now. Again, it's just help, again, bring blood flow. And then with blood flow comes nutrients, comes oxygen that help with healing. So with the, so you could use it on for example, on the neck, you put oil and then you do a scraping motion. Sometimes you'll start seeing the skin getting red. Some people do it quite hard, and it can be, it's again preference, but what it does is again helps to break down tension in the muscles, and yeah, just, you know, bring healing, you know, blood flow to the area. Yeah, and yeah, those two are the things I do at home for myself too. Yeah.
What is the name of that thing?
Gua sha.
Can you spell it? I'm gonna put it in the chat for everyone.
GUA. SHA.
Okay.
Yeah.
Perfect. And what is it made of?
People ask me that. A bullhorn, maybe.
Oh, really? Like it's like a
horn. Yeah.
It's not plastic or.
No.
It's like a natural.
Yeah. Yeah. Mm-hmm.
Okay.
Some kind of something.
Interesting.
Mm-hmm. So yeah, that's I think I covered most of it here. I'm trying to see what's on my table. Mm-hmm. Oh, quartz. Yeah. I have heard of that. Rose quartz. Mm-hmm.
Cool.
Awesome. All right. And it's interesting to know that the taping is to lift the skin for the lymphatic drainage, because I thought it was like you had muscle weakness or muscle like malalignment or something. And I thought it was kind of putting things back in place where they should be, you know, like a little lift. But I guess it's lifting.
Yeah, and I kind of, yeah, it helps to support the area, right? In terms of like, because it almost acts like a, thank you, a layer of muscle. And yeah, so then it kind of overtakes the load from the injured muscle tissue. But you're right too, yeah, inflammation and support.
Good. Awesome. Okay, well, let's maybe just pause to see if anyone has any questions or any thoughts. Shy?
About your education, did you have to do like a bachelor's of science before you did do you have a doctorate? How does that work to become a chiropractor?
Yeah, so undergraduate, you have to do an undergraduate program. So really with chiropractic college, as long as you have an undergraduate, degree, or 3 years of undergrad, I should even say that, you can apply to chiropractic college. At least the one I applied to, you can. I had classmates who did business, who did arts, and they still, got accepted into chiropractic college. So then you do 3 or 4 years undergrad, and then you go to chiropractic college, and that's a 4-year program. 3 years of, in school and practical, like learning how to adjust, learning palpation, and learning different techniques. And then the last full year is internship.
Going second career, Lindsay?
No, I was just curious. I've always what people choose to do their undergrad, and I find very curious. So what was yours? What did you end up doing?
Mine, I did a kin, like physical education and health at U of T, Toronto. Yeah. So semi-similar.
Yeah, that one makes sense.
I've always liked like healthcare. I've always liked anatomy, biology. So that was a sort of a natural path for me to go. And I love helping people. So yeah.
Awesome. I know, so I'm a kin person too, and I was going towards the avenue of physiotherapy, and for me, maybe it's just my background and preference, but I love the different modalities that you use, because I feel like they're very treatment based rather, like helping people to find a solution, kind of like physio, right? Like you have to do a little bit of the work, you have to correct yourself, you have to do some stretching. So I appreciate you for a lot of different reasons, but I like your approach to chiropractic care. So that's awesome for our community.
Thank you.
Now, and I guess maybe other people have these same sorts of thoughts, like what are people's reservations around adjustments? Like why do people prefer not to be adjusted? And are those myths, or are they?
Yeah. Or are they kind of based on some truth, right? So, so there is an association with neck adjustments and strokes. It's obviously a very low sort of association, 1 in I think 4 million or cases like that. But the thing is, when someone has an impending stroke, they can be complaining of very severe headache, and then it could be them going to see their family doctor, or then going to see their chiropractors for it. And if we don't do our due diligence of looking out for signs, and if we do the adjustment, it could sort of be associated with that, not a causal sort of link, but just with the timing, and we do have to do our due diligence. But same thing can happen at a doctor's office. For example, you're someone with an impending stroke could be waiting at a doctor's office, and then something happened at the doctor's office. So it's kind of timing, but again, though, that said, we do have to be careful with, when someone comes in with like a very severe debilitating headache, we have to look at, could it be that? And I am quite cautious too, if someone's not comfortable. I think a lot of time the perception of, neck adjustments being dangerous is from the, movies where, where we do the, they do the whole killing people by breaking their necks. So I can see, people's reservations from just, what's been portrayed out there. And also probably people's experience could be their own personal experience, or could be their friends and family's experience. Because there are chiropractors who are a bit more aggressive in neck adjustments. Neck is a very sensitive area, so I usually, I'm very, I'm definitely more cautious and gentle with neck adjustments. But I do walk through someone who's never had that done before, what I'm doing, what they can expect, and if they'll hear the cavitation, which is the pop, or not. And if they don't, I don't like to force it either. But yeah, I think the main thing is the risk of strokes people have heard of, and also just what's been portrayed out there as the neck adjustments could be aggressive, right? And going through school, when we learn how to adjust each other's necks, there can be injuries even then too. Mm-hmm.
Great answer. That imagine.
World peace.
Yeah, like a lot of training, right? Like what was that like to train adjustments on one another? Like, like you've missed 5 classes. I'm gonna go to the next student and practice on me.
Yeah. Oh, yeah. And people have, gotten hurt and injured from practicing each other. It happens, right? Yeah. Mm-hmm.
You mentioned about the pop. So can you describe to everybody, like, what is the pop? Like, what's happening when we hear that pop?
Yeah. So the pop is actually, we call it a cavitation. And I'll say it to people, a crack, or, all the same, regardless. But what it is actually the release of gas bubble in the joints. So it's pretty much like a vacuum in the joints, right? Any joint really in our body. And then when you do the quick sort of thrust through the joint, you get that release of bubble in that, in the joint, and that's where you hear the pop. And when we do our adjustments, we take the some people, depending, right, everyone adjusts differently, but for me, I like to take the joint to end range first, where you feel like it's not gonna go anymore, and then I'll get the person to breathe in, and on the way out, it's a more quick than aggressive, I should say. Yeah, a quick thrust. So yeah, and I don't like to force it, and that's when you may or may not hear the pop from the thrust. Mm-hmm.
Now, I know you're like before you came to Thorndale, your business was mobile. Are you still, do you still do the mobile, or is it?
I still do some mobile visits for sure, and it could be at someone's home or an office space. But I do find myself now more so when I do mobile visits for a family, so like a 2 or 3, yes, kind of treatment. So yeah. But
we're just all lined up, right?
Yeah, exactly.
Okay.
That's that though. Like I have had, people even in the community, right? Like if they had a fall or they're in so much pain, they can't, then obviously I'll make the trip out, to see them as well. Mm-hmm.
I think that's great to know, especially with your location, like being the 2nd floor. If someone has mobility concerns, would you be able to go out and treat them? And is that different right now, like with COVID, right? If we just take the same precautions.
Yeah, exactly. Yeah, mask and all that. But it's funny that you mentioned the stairs, because sometimes I feel for people who are in pain and have to take those stairs, and people would joke like maybe we should get Tim, the landlord, to install elevators or something. Yeah, I'll talk to him about it.
Yeah, I think Arden's keeping her eyes open for an accessibility grant.
Oh yeah, wow.
In all of our other spare time, she's just there. There's a question here from Cheryl. She asked, do you help people with neuropathy pain?
So nerve pain, right, Cheryl? That's mainly what you're asking about. So yes, for sure. Nerve pain is, definitely more tricky in that sense, and the nerve pain is obviously more severe as well. Depending on what kind of neuropathy, if it's coming from the spine, if it's an impingement, or, then in the in the legs and hands. Okay. And is it a generalized sort of neuropathy then pain? Or is it a numbness or is it sharp shooting pain? I'm sorry, I'm asking you a lot of questions. Because sometimes it could be a very, okay, okay. I wonder in that case if it's have you had imaging done in the spine? And you don't have to answer because this is your, we can have a private chat after. Okay. But yeah, if it's something that's, like from the spine and that we can sort of work through to release the tension in the neck or the low back. Okay, okay. Yeah, so if it's something that's okay. It just kind of came on. But yeah, for sure, like we can chat too after. But if it's something that is specific, to certain maybe nerve roots in the neck or in the lumbar spine, we can kind of work in through the area, release some of the tension in the muscles, or okay. And yeah, very possible. Then if it's more related to sort of, it's hard to target, I should say. But we can still, give it a trial of treatments, work on the muscles, work on the joints, use modalities like laser to help with the healing and see if it helps. You're welcome.
It's better than Google, right? Like our own trusted professional. Google will give you a lot of different answers.
Google's scary.
Yeah. Okay. Does anyone else have a question? Judy, I saw your camera come on. Do you have a question? Do you want me to unmute you? There you
What difference is there between physiotherapy and chiropractic? Some of the things you're describing are similar to physio. Are you crossed that way at some point? Yeah.
Yeah, so you're right though. Someone, my colleague has one said to me, you're kind of practicing like a cross between a chiropractor and a massage therapist and a physiotherapist. I do give simple exercises like stretches and strengthening exercises, but when it comes to rehab, I do find, I do refer out for physios because they are the experts and professionals on rehab. For me, I'm more hands-on with pain. Like I like to help people with pain. So that's why I have modalities, which is what you said, right? Like similar to the physios, just to help, have another tool in my toolbox to help with the pain and healing process, pain management, I should say, and then the healing process of the body. Yeah, but it's kind of a bit, yeah. There's some, I guess, crossing of my my work with physios work and even like massage therapy as well, because I do a fair amount of soft tissue massage of my treatments.
Right. I had a bout with bursitis and did physiotherapy, but now I'm wondering, would chiropractic?
Okay, yeah. So inflammation. So I like to use a lot of laser on, like for bursitis because there's inflammation, and then taping if it's, really swollen or warm, and that definitely muscle massage through the area just to release any tight muscles in the area.
Okay, thank you.
You're welcome.
Dr. K is like the Swiss Army knife. Like she can,
Yeah.
she's got it all. We want. I know that in the community, that I guess this is before we had a massage therapist, which is wonderful that we have a registered massage therapist now who's actually in the same building, just around the corner from your room. But a lot of people asked about like direct billing and, how can they use their benefits? So do you want to talk a little bit about like payment and?
Yeah. I can direct bill most insurance companies. So like Green Shield, like the typical ones, Manulife, Canada Life, Sun Life, industrial lines. There's a list, big list, and the list grows because the portal that I'm on, like they try to add more and more insurance companies to it. So that makes it easier for, I think, for my patients and myself if I can direct bill, because then they don't have receipts that's piling up and to send away, right? Whereas I can just do it quickly, and then most of the times. The portal, like the system I use, will tell me right away how much is covered, if it's fully covered, or if there's a percentage, or they'll tell me if there's a deductible. So then I can tell, the person right away what the balance is. Yeah. Mm-hmm. But again, a lot of times, if people don't have, payment on them, it's okay, because we live in a small town. Like it's, really, it's no problem, right?
Like, could Mel pay you with sourdough bread?
Right.
Is that a payment that's accepted?
I heard it's really good. It's tempting.
2 chickens.
That'll cover it, eh?
Yeah. We'll go back to that, right?
Well, in difficult times, I guess you gotta take what you can get, right? What can people expect, like if they were to contact you for the first time, like what does becoming a patient look like, or a client or patient, or is it the same?
It's the same, yeah. So for the first time, there's paperwork, sort of, like your basic information, what's hurting you or bothering you, and then consent. Consent is a big thing, in our profession, right? And then after the paperwork, and then I'll go through your history, sort of what caused the pain, what happened, how long has it been bothering you, what kind of pain it is, what aggravates it, what relieves it. So that's the history part of things. And then after the history taking, I do a physical examination, and you usually start with range of motion. Range of motion can tell me a lot about sort of what's causing the pain. And so range of motion, and then some orthopedic tests. And then after that, we'll go through another consent called report of findings, where I will go through, this is what I think it's going on, so diagnosis, and then what I can do to help you. And then obviously, everything that I do has to be your comfort level. If you're uncomfortable with shockwave, for example, we won't do that. If you're uncomfortable with deep tissue massage, we won't do that either. So everything is to your comfort level. And obviously with adjustments, if someone who has never been to a chiropractor before, I'll say, why don't we start more conservative? And then as you get comfortable with what I'm doing, then we can, slowly introduce adjustments if you want, if you're comfortable with. And some people will tell me right away, I'm not comfortable with neck adjustments, and that's okay too. Yeah. There are ways to work around your pain. So, massage or stretching, mobilizations. So if you're uncomfortable with adjustments, it's really, no problem. It's what you're comfortable with, and I want you to feel comfortable, and I want you to get the benefits of the therapy as well. So that would be it. So a treatment.
Yeah. And then their treatment plan is just based on kind of like your findings and their response to your treatment.
So typically, someone who comes in with acute pain, so like a fall or something that's more acute, the treatment plan is usually closer together. So maybe like 2 times a week for the next 1 to 2 weeks. Whereas a chronic pain issue, usually we take it more slowly over, like once a week over 4 to 6 weeks kind of thing. But we always kind of see if we're heading in the right direction or not, because if we're not, getting any relief, either we're thinking of referral or we're thinking of imaging. I think imaging is a good one to kind of see like what's going on. And chiropractors can refer for x-rays, but we cannot refer for anything else. So sometimes I'll tell people like, we can start with this, especially, knee pain, and if there's arthritis, like I can refer for x-ray for knee, but if there's more imaging to be done, I don't have that power to do so. But if you go through your family doctor, for example, in this case, right, you go through your family doctor and then they get the report and they can say, yeah, we need more imaging, and they can refer quickly for, because your family doctor would have your x-ray report sort of, for that. Mm-hmm.
That's good to know. I didn't know you were in that kind of circle of care, right? Where you can.
True. Yeah. Not that I talk to a lot of family doctors, but, it's I think, when people start to have, as we mature, and our joints start to, wear and tear, because of how our healthcare system is, it's always a process, right? So I'll just tell people to maybe get started with it. So when you do get imaging, it's not maybe not as long of a wait, but you're kind of ahead of the game in that sense, because it's always months after X-ray, it's months to get MRI referral, and then after the MRI, again, months to get an orthopedic surgeon referral, and then months for so if you can get something started sooner, then then you can get it.
Catherine had a question. Do you suggest monthly tune-ups or only when you feel you need it?
So it really is up to personal preference. I do obviously see people, on a monthly basis or on a maintenance basis, people say. And maintenance is all, again, preference. It could be once a month. Sometimes people like it once every 2 weeks or 3 weeks. It's all, preference. And then some people prefer just coming in when they have pain. Yeah, so it's really a preference. If you find that your job, for example, if you have an office, you're on the computer a lot and sort of the same pains, over time, maybe a monthly thing would be good, just to get the muscles worked on, the joints moving again, so that you're good for a period of time, and then we'll work on it again. Or sometimes I'll tell people, if they have good benefits, right, what you can do is you can do chiropractic a month, and then so essentially chiropractic care once a month, massage therapy once a month, so you could stagger it almost like every 2 weeks you're getting care. So chiropractic, and 2 weeks later massage, and then 2 weeks later chiropractic again, right? So depending on what, if you have good benefits, you could do something like that as well.
I think that's how my dad spends his retirement. He runs through the different services.
That's a good retirement.
Yeah. I don't know. I know you mentioned, I think it was using laser on children. So what is like the youngest age that you would treat, or why would you treat someone that's an infant or child, or however young they are?
So I would treat children. Like if it's an infant, I would refer out, but I have used the laser on infants with, working at other, before I had my own practice, I worked at a practice that, they would use, and I would use laser, on my kids as well when they were younger too. Funny story, like Caleb had a goosebump one time, he hit his head and I put laser right away, and the next day it went down. So laser helps with healing, and especially apparent with young children, they seem to respond very quickly with laser. So that's one thing I've used it on, people with concussion as well. Even sinus, like pain, I've used it on sinus pain. But treating wise, I would treat probably 4 and up. Yeah. But infants, and chiropractors do work on infants, but I'm not comfortable with that. It's probably better with, someone with more expertise in that.
I never even thought about like sinus pain and all of that.
Yeah.
So,
Sorry, did anyone say anything?
Nope.
Okay. I like your bunny, Chelsea. So the activator, sometimes I'll use it on people with sinus pain as well, or people will complain like they have really full sinuses, and I'll use this to tap here. So on the 4 sinuses here, and then people will tell me sometimes they'll feel like the sinuses draining right away. Yeah, so different tools to use on different things. Yeah, but if you have anyone has any sort of complaints or pain or aches or anything, just let me know, even if we're treating something else, and then I'll try to see if it can help too.
So you could have a little spring rush with a season
with this.
Just go around the community, like door-to-door visits, just like blasting people's sinuses.
That's right.
Okay. And I know like you've treated like even our own family, like plantar fasciitis and like that kind of stuff. So yeah, I think the sky's the limit with Dr. K. So
I try definitely. I'll do my best to help. Yeah.
Perfect. Okay. I know my assistant is here, which means it must be getting time to wrap things up. So I guess before we do, are there any other questions or thoughts that people have or anything you want to share? No? Okay, I remember the day we met Dr. K. So we were at the library and presenting for our business directory, and Dr. K came in with a gift, and she was new and was really eager to really get involved in the community. And she's volunteered from the very beginning at our community events, and asking how she can lend a hand. So I think that's so. That's the strength of our community, because our businesses obviously don't just, do their business and, factor in at the end of the day. They're really involved and really engaged. And I think it's wonderful that you joined our community that way. And we really appreciate having you part of it.
And I really, I feel so blessed, being part of this community, making connections, with people in the community. Yeah. And I really think this is, Thorndale is so great. Like, we really, do help each other, everything, even with the youth, youth group coming into my building. Sandy and Murray, like, brought money to donate to the youth. I'm like, this is why Thorndale is the best, right? Like, we really try to help each other out. And yeah, it's so nice to see. But no, so thankful for your support, even through, the lockdowns and whatnot. Yeah, thank you.
Yeah, so that's a good little segue. So I know in a couple of weeks, we hope to be at our new space. So what are we calling it, Arden? The Thorndale Community Hub and Youth Clubhouse? Is that the name?
Yep.
Yeah, so we are, Arden's been working really hard day and night to get this physical space developed for our community. So are we going to share anything right now, Arden, or wait until 2 weeks from now? Yeah, everybody has to come back. So
We're going to say, Kay, you rock that. Well done.
Oh, thank you. Thank you. I hope we had fun. I hope we all had fun.
Yeah, absolutely. I learned several things.
Oh, good.
Okay, so next week we have Lori Aarons from Edible Acres, who's going to talk about organic farming. And then the following week, we're going to wrap it up. I Love Thorndale will be our host to talk about the space and what is to come next. So thank you everyone for joining. And I see there's lots of comments about Dr. K being so great, and I have to agree. So it's so nice.
I hope you guys did learn something about what you can do at home too. Yeah. But again, like, feel free to text me. Like I say to people, like, you have my number. Even if it's a question about, any pains or, just feel free to text me. I'll try to help if I can. Yes, Chelsea.
My heel hurts.
Oh, Chelsea has heel pain, so we'll give you a call.
Oh, okay. Okay.
Thanks, Kay.
Oh, you're welcome, Mel. Good to see all your friendly faces.
Yeah.